Welcome to Mobility and Joint Health Daily, where we explore the latest breakthroughs and innovations in joint health and mobility. And today we're going to talk about a silent joint killer that's hurting many of you right now, and that is cartilage loss or damage, which can lead to joint pain and stiffness. You see, cartilage is the cushioning material that covers the ends of bones, and when it's damaged or lost, it can cause friction and pain in the joints. Many of you may be experiencing this right now, and it's affecting your daily activities, making it difficult to walk, run, or even perform simple tasks. But the good news is that there are new breakthroughs in cartilage regeneration that can help to reverse this damage and restore joint health. To stay up to date with the latest information on joint health and mobility, be sure to hit subscribe and turn on notifications, because we post new videos every week. And today we're going to dive into the latest research on cartilage regeneration. You'll learn about the current state of cartilage regeneration treatments, including their limitations and side effects, and we'll explore the new biomaterials and therapies being developed to help regrow damaged cartilage. By the end of this video, you'll have a better understanding of the latest breakthroughs in cartilage regeneration and how they can potentially benefit you. The latest breakthroughs in cartilage regeneration are truly exciting, and they offer new hope for millions of people suffering from joint pain and stiffness. One of the most promising areas of research is in the development of new biomaterials that can help to regrow damaged cartilage. For example, a recent study published in the journal PMC found that a new biomaterial was able to regrow damaged cartilage in joints, and this has the potential to revolutionize the treatment of joint pain and stiffness. The researchers used a combination of stem cells and biomaterials to create a scaffold that could support the growth of new cartilage, and the results were impressive. The new cartilage was able to withstand the stresses and strains of joint movement, and it showed great promise for the treatment of joint pain and stiffness. Another area of research that's showing great promise is in the use of platelet-rich plasma, or PRP, to stimulate cartilage regeneration. PRP is a treatment that involves injecting platelet-rich plasma into the affected joint, and it's been shown to stimulate the growth of new cartilage. The platelets in the plasma release growth factors that help to stimulate the growth of new cartilage, and this can lead to a significant reduction in joint pain and stiffness. For example, a study published in the Journal of Orthopedic Research found that PRP injections were able to stimulate cartilage regeneration in patients with knee osteoarthritis, and the results were impressive. The patients who received the PRP injections showed a significant improvement in joint function and a reduction in pain. And this is a treatment that's available right now. In addition to these treatments, there are also several exercises that you can do to help stimulate cartilage regeneration. One of the best exercises is a simple knee bend, where you stand with your feet shoulder-width apart and slowly bend your knees. This helps to stimulate the growth of new cartilage in the knee joint, and it's an exercise that you can do at home. Another exercise that's helpful is a leg press, where you sit in a chair and press your legs against a resistance band. This helps to stimulate the growth of new cartilage in the knee and hip joints, and it's an exercise that's easy to do. For example, you can start by doing 3 sets of 10 repetitions and gradually increase the number of sets and repetitions as you get stronger. It's also important to remember to warm up before you start exercising and to cool down afterwards to help prevent injury. The current state of cartilage regeneration treatments is also an important topic to discuss, and it's an area that's rapidly evolving. While there are many treatments available, they often have limitations and side effects, and this is where the new breakthroughs in cartilage regeneration come in. For example, many of the current treatments involve surgery, which can be invasive and expensive, and they may not always be effective. But the new biomaterials and therapies being developed have the potential to revolutionize the treatment of joint pain and stiffness, and they offer new hope for millions of people. The new biomaterials, for example, can be used to create scaffolds that support the growth of new cartilage, and this can be done through a simple injection or implantation procedure. The therapies, on the other hand, can be used to stimulate the growth of new cartilage, and they can be tailored to the individual patient's needs. The new biomaterials being developed are also an exciting area of research, and they have the potential to revolutionize the treatment of joint pain and stiffness. For example, a recent study published in the journal Nature found that a new biomaterial was able to regrow damaged cartilage in joints, and this has the potential to be used in a variety of applications. The biomaterial is made up of a combination of natural and synthetic materials, and it's designed to mimic the properties of natural cartilage. The researchers were able to show that the biomaterial was able to support the growth of new cartilage, and it had the potential to be used in the treatment of joint pain and stiffness. This is just one example of the many new biomaterials being developed, and it's an area that's rapidly evolving. In addition to the new biomaterials, there are also many new therapies being developed to help stimulate cartilage regeneration. One of the most promising areas of research is in the use of stem cells, which have the ability to differentiate into different types of cells, including cartilage cells. The stem cells can be used to create a scaffold that supports the growth of new cartilage, and this can be done through a simple injection or implantation procedure. Another area of research is in the use of growth factors, which are proteins that help to stimulate the growth of new cartilage. The growth factors can be used to create a scaffold that supports the growth of new cartilage, and this can be done through a simple injection or implantation procedure. For example, a study published in the Journal of Orthopedic Research found that a combination of stem cells and growth factors was able to stimulate cartilage regeneration in patients with knee osteoarthritis. The single most important thing to remember is that cartilage regeneration is a complex process that requires a multifaceted approach. It's not just about using one treatment or therapy, but rather a combination of treatments and therapies that are tailored to the individual patient's needs. This is why it's so important to work with a healthcare professional to develop a personalized treatment plan that takes into account your unique needs and circumstances. By doing so, you can ensure that you're getting the best possible care and that you're taking advantage of the latest breakthroughs in cartilage regeneration. For example, you may want to consider a combination of exercises, such as knee bends and leg presses, along with treatments like PRP injections or stem cell therapy. You may also want to consider using supplements, such as glucosamine and chondroitin, to help support cartilage health. In conclusion, the new breakthroughs in cartilage regeneration offer new hope for millions of people suffering from joint pain and stiffness. By understanding the latest research and developments in this area, you can take advantage of the latest treatments and therapies to help restore joint health and mobility. Remember to always work with a healthcare professional to develop a personalized treatment plan that takes into account your unique needs and circumstances. And don't forget to hit subscribe and turn on notifications, because we post new videos every week on the latest topics in joint health and mobility. By subscribing to Mobility and Joint Health Daily, you'll get access to a wealth of information and resources on how to maintain healthy joints and mobility, and you'll be able to stay up to date with the latest breakthroughs and innovations in this area. So thank you for watching, and we'll see you in the next video.